That'd be a change.
You're wearing the teddy
Hey, at least the way you guys sat, it's black.
All right, here we go. We're live. Good morning, everybody. Welcome to the first issue of Eggs and Issues this year. Today we have the healthcare professionals from Mahaska Health here to help answer questions and talk about the vaccine and other items that are important for folks to know what's going on with the coronavirus in Mahaska County. So I'm going to turn it over to our panel from Mahaska Health and Emergency Management here in Mahaska County. We have Kevin Durande, and I'll let everybody go through and say who they are and what your positions are here. So I'll turn it over to this panel, and we'll get things started.
Jamie Robinson, Mahaska Emergency Management. I am the EMA 911 administrator.
Tim Breon, I'm a general surgeon and chief medical officer at Mahaska Health.
Hi, I'm Denise Skipple. I'm the Director of Population Health and Quality at Mahaska Health.
Patty Malloy, Mahaska County Public Health Coordinator.
Kevin Durande, CEO of Mahaska Health.
All right. If you guys would just want to talk about the status of the vaccine in the county, and I think we heard about 1A. Is that where we're starting to go with things? We'll just kind of kick it off there and let folks know where we're at.
Yeah, I can take that question. We are currently in 1A in the state of Iowa, and that is for the healthcare workers and long-term care facilities. So that's the group that we're currently vaccinating at this time. There's a committee at the Iowa Department of Public Health called the Infectious Disease Advisory Council. So they will be meeting sometime next week to determine from the CDC guidelines who will be in the next tier. So that would be the 1B. So once Iowa gets through their 1A group, then they will move on to the 1B. And they kind of want to do it, the same throughout Iowa, just to be consistent. So we still have long-term cares that are being vaccinated through the larger pharmacy groups like Walgreens, CVS, and community health groups. So that's taking place. I know we've had one facility in Mahaska County that has been vaccinated, and next week we have another one that will take place, and I believe the following week, from the information I received yesterday, will be the next week. So once that, and then our healthcare workers, which is kind of different categories, the hospital has done an excellent job vaccinating, getting that done, and so we can move on to the second dose, which makes you fully vaccinated. So that's where we're at. We have a lot of calls coming in, people wanting to know when, and we're still waiting for that 1B group, and it's exciting for healthcare, and I know everybody out in the community.
Yeah, so we have some ways that we'll let you know about 1B. 1B, just broadly, we know is going to include people with essential services roles, people that we need to keep the community running, and those folks who are over 75. We're not currently taking any reservations or making lists for those, but we will let you know through a variety of ways. So I know the important thing would be to make sure that you're following Mahaska Health on social media and paying attention to news outlets like Oski News for that. And then I think I'll let Jamie talk about how to get signed up for Mahaska Ready.
Yeah, so as a lot of people know, we have it's a reverse 911 type system that will call or send out text messages. Right now, several citizens get it for weather alerts, that type of stuff. So we're also going to utilize that for the vaccine as well. So talking with Mr. Durande out at the hospital, we're going to actually tag the link on both the Mahaska Health website and the MahaskaReady.com website. So you can go on there and sign up. If you have elderly relatives that may not utilize cell phone technology or text messages, that type of stuff, it will call their landlines. So them at home can get the notification through that system. We won't be pushing out tons of notifications other than when public health says, okay, we're ready for this next group, and, you know, some information as far as where the vaccines and stuff will be. So I don't want people to think we're going to get 500 new text messages. So we try to be very cautious what we utilize that system for, because we don't want anybody, you know, replying stop and then they quit getting emergency notifications. So it is a good system, and I would encourage people to sign up for it, not just for the vaccine, but for everything else as well.
So as we've moved through 1A, we've been able to give vaccines through our healthcare facility and the healthcare providers in the county. And just to talk a little bit about the supply, in planning, as you know, plans are based on estimates, so we received a certain amount of vaccine. We are still kind of beholden to the state, so we can only use it for those particular people. Counties that have extra vaccine can have that redistributed to other counties that need it more. So while we have not used all the doses we have, we do have to stay in those categories to stay in the guidelines from the state, basically. So we're anxious and looking forward to that next phase just as much as you are. The good news is this first phase has been smaller. It's helped us hone our vaccination clinic kind of procedures. So we've got our vaccinators and our clinics kind of down to a science now. It does require folks to wait for 15 minutes after their vaccine. So I know that is a challenge when you look at mass vaccinations. It's not maybe necessarily the kind of thing that we drive-through is not maybe the best option, although we may have to utilize that in some cases, because we do have to have people sit for 15 minutes so we can observe for any reactions. But that being said, we haven't seen any of those so far. So do we want to talk about the vaccine at all? Okay, are there any questions about the vaccine specifically?
Yeah, there's one that came in. It says, how is morale among our local health care workers? This is from Allison McGuire. That she just asked how the morale is right now amongst our frontline healthcare workers.
Excited. I think the day that we gave the first vaccines, I know for me it was, wow, this is a game changer. So lots of the staff coming in are just elated that we finally have something that we're able to maybe stop this this virus, so, and keep it under control. So yeah, everybody that's come in even this week are just really happy. So I've even had people say it just changed our office when we heard that we could get it. The morale just was totally different. So that's exciting. I just can't explain how much, we've been doing a lot of contact tracing and following the disease, and now we can actually start putting a stop to it.
I was talking with a couple of doctors in our ED the other day, and we were actually reminiscing about the early days of COVID when we didn't know very much and we had a lot of anxiety, and talking about all that's transpired. So it was a really incredible year last year. People put in a lot of hours, really dug in. Our learning curve was steep. We learned on the job. We saw a difference in how we treated patients. We developed protocols. We got the resources we need. We worked with all our partners. And to have this come, particularly the week of Christmas, is when we put those first shots in arms, and it was the best thing we could have asked for. And believe us when we say we cannot wait to bring that out to the other phases. So after we get through 1A, we move on to 1B, into 1C, and really can't wait to share that with everyone. So.
And I think also a cool thing is that many of us, when this first started, weren't hopeful for a vaccine for a year or two. And there were times we were being told maybe 3 years for a vaccine. And understanding how long it takes to even make a vaccine, we wondered. But I think just to the credit of the healthcare system and researchers and scientists, in the 50s or 40s when they were developing vaccines for polio and other pandemics, and we haven't had a pandemic for quite some time in the U.S. And at those times, they were very limited on their ability to make vaccines just because basic sciences and research things were at a point, you know, if you can remember what your TV set looked like in the 50s or your car was like in the 50s, quite a bit different. And so now we have resources and abilities that are never been known to man. And so the fact that they were able to get a viable vaccine this soon is credit to the medical community. And so we're excited as physicians and providers and staff that are dealing with this, that we actually have a vaccine and a good vaccine that we can use in a timely fashion. And it's nothing to be feared, it's actually something to be celebrating.
All right, I'll come a little closer, folks, so they couldn't hear me very well. A question from Steve Burnett here in town. It says, it would seem reasonable to be able to vaccinate an entire nursing facility in a day. Why does it take a week? You mentioned doing one each week. There seems to be a lack of urgency in this deployment.
So we actually had a call this week, yesterday, regarding that with the local public health administrators in a lot of the counties, and that is something that, you know, was discussed. The CVS and Walgreens pharmacies that have taken this over, they have been allocated the vaccine for these, and so they are rolling it out as fast as they can. So we don't have a lot of control over that here at the local level. You know, we had even some counties asking, you know, could we go and do some of those facilities? But again, the allocations have been given to 1A. Those pharmacies got what was projected for the long-term care, so it is frustrating. I understand. So that's, you know, we're working. They're working as fast as they can in that area. So.
And I guess the week is just kind of when it's happening. So they're coming here probably a day and
Right.
doing them. So these pharmacies that would be in charge of vaccines, they might come to Mahaska County and do one of our care centers on a Monday, and that means residents and staff. Then they may go somewhere else on Tuesday, somewhere else on Wednesday. So they're handling they're handling all the care centers in the state. So while it may seem frustrating and slow, they are definitely taking care of a lot of facilities.
A question that we had was for emergency management. I know that people are confused about what that role is for emergency management in a pandemic. Tell me how you and your office integrate with public health and for the benefit of Mahaska County residents and even beyond.
Yeah, so my office has been very busy during the pandemic. Of course, we're here to support the hospital, public health, the schools, the care centers. And actually right now we're supporting Southeast Iowa with PPE through the state and Iowa Department of Public Health. We basically work side by side. We're part of the task force meetings, several meetings a week, looking at the big picture. And I can tell the community, I've seen it firsthand being in these meetings, the things the hospital has been doing over the last several months that, I mean, I'm sure you've seen the sheds and you've seen little, traffic's been moved, but the stuff that they've done out there is just short of a miracle. I mean, they've really worked their butts off out there. And anytime they need something to make that happen, we're there with them, trying to make sure that we can find the resources and the tools to make it happen. PPE, we're getting tons of PPE. We've supplied tons of PPE to the hospitals, to the schools, to the care centers. So we've had a couple of outbreaks at our care centers. Anytime they hit outbreak status, we are basically drowning them in PPE. We give them tons of masks, and we try to give them that stuff ahead of time too. You know, we look at any request that comes in, and we try our best to find the resources that are needed to try to mitigate the effects of COVID. So yeah, I mean, the big thing for us is working with them. We have meetings with the schools, both the grade schools, the high schools, the William Penn College, the care centers. Yeah, it's meeting after meeting and finding the resources. And again, I'm so thankful for our Mahaska County CERT team. And I'm going to, shout out to Deputy Chief Jim Walker. Him and his team has been phenomenal. They've helped deliver PPE throughout Southeast Iowa for the state of Iowa, making sure that everybody has the resources that they need, and that's huge. We're warehousing for the state of Iowa right now here in Mahaska, which is kind of nice because when the hospital needs something, we now have it on a shelf. We don't have to wait for it. But we're doing that for everybody in Southeast Iowa right now. So we're staying very busy with that. And with the vaccine rolling out, you know, if we need to do drive-throughs or whatever they need to set those up, we're going to be right there supporting it. And that's my main focus, is making sure everybody has the tools and the resources that they need to do what's needed for the community.
And I'll just add to that just the relationship that we have with Jamie from the hospital. He was a previous employee at the hospital. And so just the relationship that was already established, you know, the emergency management team didn't really have to be involved as much as they were. And so just because of Jamie's efforts and all of their efforts, they've been a valuable resource to the hospital. They've been an extension of us in an excellent fashion for the care facilities. Through these task force meetings, he identifies things that he can take part in. He can supply with PPE and just lots of things. So we just really appreciate the emergency management team as well for all the work they've done and the way they've coordinated that with the hospital. And it's just really cool to see those relationships be developed and nurtured through this time too, because we are a healthcare team, the emergency management team, the public health, the hospital administration. So it's been one team that's pulled together to facilitate this. So we're thankful for that too.
So we have a question coming in. Some folks would like some clarity, more information on when those that are age 65 plus may have access to the vaccine.
Yeah, at this time, it looks like for the CDC, it's 1C. Again, that Infectious Disease Advisory Council at IDPH will meet and go through those tiers that the federal government has set up, the CDC. So yeah, it looks like right now 65 and over will be in the 1C.
All right, and I'll try and speak loud so folks can hear me, but another question, this is from Sandy Bailey. She goes, how many people do you estimate you can vaccinate in one day?
Ooh.
Yeah, well, actually, good question, because I've been working on that. So we do put through time. So when we are doing our clinics right now, we're logging when a person arrives and when they get their vaccine, and then their 15 minutes. And currently, you know, we've been doing obviously some smaller groups, but we have about, from registration to shot time, anywhere from maybe 6 to 8 minutes, and then they have 15 minutes to sit and wait. So, you know, we're doing smaller groups, but as we get the more vaccine, I think our put through times are going to be pretty good. So,
Is that the how do you say, the small, I mean, you have this pipe of vaccine, but right now it's just not a very big pipe that's coming in.
right, yeah, we were allocated enough to do what they determined would be our 1A group. So when we move on to 1B, we'll be allocated another amount of vaccine to cover that group too.
I think the other thing with that too is just as we get more vaccine, we'll be able to pull in more vaccinators. So it's not a complicated vaccine to give. We've had other groups give it. We've identified other resources that can help us with that. So I think we'll be able to meet the demand.
Well, this is from Jennifer, and it pigeonholes right into that. She goes, have you added more staff? What have you done to be able to mass vaccinate? Do you have plans for that? I mean, I think we've all seen movies, you know, and what's the plans for that? I mean, because we're probably going to have an influx of folks when that becomes available.
Yeah, as public health, a department of the hospital, it's unique. So we do have lots of staff that I've had offers from people that say, hey, if you are doing a Saturday clinic or something, and we have a lot. We will have adequate staff. I don't doubt that at all. We have been using other staffs from throughout the facility as we need to do some of our contact tracing and other things. So, yeah, that's definitely something that we're working on.
And kind of this is not uncharted since we did some of these clinics back in when H1N1 hit. So it's kind of all hands on deck, and I think everyone becomes a public health nurse at that time in order to pitch out.
Well, and the staff that have been doing the hospital staff is our OC health department, so, and our clinic nurses. So a shout out to them because that's been able to allow public health to work on more of the community healthcare systems. So that's been very helpful.
Well, the question that just came in is which vaccines does Mahaska Health have access to? Is it the Pfizer vaccine? Which one is it? And then we'll make that a second part question, and maybe a little bit more technical, is how does the vaccine really work? So does it, you know, there's concerns. We've all heard, you know, does it change your DNA? How does it do all of these different things? You know, so maybe some information so folks actually understand how the vaccination itself works.
Well, I'll take the question on what we're getting in the county. So we're getting Moderna for our hospital staff and community. The long-term cares will get the Pfizer, so that's the ultra cold, and so there's some storage and handling issues of the temperatures. So that's why the bigger pharmacies took that, which is another reason why they went with long-term care, so they could do more mass vaccinations. There's just logistically, even with the Moderna, it's not like a one dose and you can give somebody a shot. You have to, once you open a vial, you have so many hours to use it and so many doses. So that's been different, I think. The one thing that for planning is you can't just open it and say, here's your vaccine, and you have to have, you know, enough people to utilize that in a specific time frame. I'll let Dr. Breon handle the. He does a great job.
So the vaccine really is just like vaccines we've always had. I guess the first thing is what's in a vaccine, and so many people think that vaccines have all these things in them that are dangerous, and really all a vaccine is just one little bit of the piece of the virus that we could recognize the virus with without getting infected with it. And so that's the most important part. Then there are things in the vaccine to keep that viable. So there's salt to keep it pH balanced. There's lipid to transport it and to keep it in solution. And there's sugar to keep it viable. And that's really about all that's in a vaccine. So it's just a mixture of those things, keeping the RNA, which is the bit of the virus, so that we can actually recognize that. What is a vaccine? And I think, you know, if you lived in the 50s and 60s and you like cars, if somebody handed you a taillight off the back of a 59 Cadillac, you could look at that taillight lens and most people would say, oh, that's a Cadillac. But you didn't have to see the whole car, you just saw the taillight. And so a vaccine is really just taking a small bit of that virus, and they actually found the messenger RNA that codes for the protein that's put on the surface of that virus. And so we can replicate that piece of genetic material that goes into our body. That messenger RNA goes in to the DNA, and that codes for a specific protein that makes that surface protein that the virus would have without making the rest of the genetic material that the virus has. And then our bodies can make that little bit of protein. It's like a Snapchat message. It comes in, makes one message, and it's gone. It doesn't incorporate itself into our DNA. It's just a simple message that comes in and tells our body to make that specific protein for just a second. That protein goes on the surface of our cells. It doesn't change the function of our cells. It doesn't hijack the cells like our virus would. And then our body can recognize that surface protein as something foreign, make an antibody against it, and then if you ever get the virus, those surface proteins will be immediately recognized. Those antibodies, which are already prepared to be made, would be made really quickly and would kill the virus. And so it's a simple process.
So are we finding out if the vaccine is currently able to help with the variants to slow those down? And then second part of that would be, are we looking at booster shots to help, you know, every 2 years or some, you know, that's an arbitrary number I just threw out there, but a booster shot every so often to help keep people vaccinated against this?
Yeah, so we're learning as we go with the vaccine. Right now, the earliest indication is that the immunity may last for quite some time. So right now, and I guess this is a point too on both vaccines. The Pfizer, there's a second dose after 21 days, and the Moderna, there's a second dose after 28 days. But we're not seeing any indication, or we are seeing the indication that the immunity is longer lasting. And what was the other part? Oh, and the variants. There is also some, there's also some indication that it will cover the variants out there. However, again, we're going to learn that as we go. So if there are other variants, I'm sure that they will go to work on vaccines that would cover those as well. So.
And I mean, people are curious, so I'm getting questions.
Yep.
There's a specific groups. I mean, I think groups of folks are interested. Hey, you know, I do such and that. So teachers are curious as to when they might be in line. Is it, you know, 1A, 1B, 1C? When is that that the educators would probably fit within that guideline.
Yep, teachers are in 1B. As far as everything we've seen, teachers are going to be covered in 1B. So that would be the next phase that we're coming up to. We're very excited about that.
And that is something that the IDAC Council is working on. Again, we'll be more, depending on how much vaccine Iowa gets, that will make a determination on that as well.
High school and college.
Yes, that would be teachers, instructors at any level, so, yeah,
Okay.
yep.
And this one's probably more for Kevin. I'm sorry, I have to wake you up a little bit over there. But we've all seen and heard lots of reports about the financial health of hospitals through this because, quite frankly, it's been a challenge for them. You know, the elective surgeries, I mean, those sources of income that hospitals depend upon have been changed a little bit. So folks are curious about the financial health of the hospital and the additional costs that come with that. So kind of walk us through the health of Mahaska Health.
Great question. Well, first of all, it is National Law Enforcement Appreciation Day today, and so we want to thank our local police and sheriff and deputies. Thank you for your service. Yeah, great question. Appreciate that. At our hospital, thankfully, we were one of the few facilities that did not furlough, lay off, or reduce hours of our employees. We stood our ground and we were able to really invest in our people. Our people are our greatest asset. And so during a pandemic, and yet we did have a loss of revenue, but thankfully we had the CARES Act funding. We also applied for Small Business Administration, the Paycheck Protection Program. And so those funds have really made us whole. And so financially we're doing very well. And even though volumes did go down, we were able to utilize that funding, which was intended for the wages of our employees. And so I just want to thank our physicians, providers, and our nurses for taking care of the needs of our patients and the needs of the community and doing that in a safe manner. And so, thankfully the hospital is doing very well financially.
All right. So, of course, just because we have the vaccine doesn't mean that the virus isn't still out in the community. Kind of get an update a little bit about how the testing's going. I mean, how our numbers are looking. I mean, everybody's really been focused on numbers, and that's the measure. Are we going up, down, staying? Some kind of let us know where we're at here.
Okay, sounds good. Yeah, I was thinking people would want to hear about numbers. So we're at about 1,800 cases to date. I'm going to say that we've had 90 new cases in January. We were at about 500 cases in November and December each. So that's kind of where we're going. We are seeing, more spread in kind of just every area, of course. We have our folks who do surveillance, great job doing surveillance at William Penn, and I would be remiss if I didn't give them a shout out. They've done return testing, and they are really great partners. I can't imagine going through this without them being in tip-top shape like they are. We also have surveillance testing at the long-term cares with the residents and staff. But we're just kind of seeing, some of those things that, from gatherings, we see folks that get together and spend time in close quarters. We don't tend to see random spread. It seems like most people know where they've gotten it. So we still are continuing to see about the same levels of hospitalizations that we have throughout. So nothing that would indicate that it's more virulent or anything.
And along those lines, I think it's important to, talk about what steps folks in the public can do to help protect themselves, protect their neighbors, protect those that they're around. As we sit here, we all have masks on, and that's something I know you, Dr. Brown, when we've spoken before, you talk about, the positives that come with that. So walk us through some of those important things that we should be doing as people to help ourselves and help our neighbors.
Just quickly, I think when this first started, nobody was sure how effective masks would be or how effective anything would be. We just knew that the same principles that we apply to sterility in the operating room and to being clean in the inpatient units and to try to prevent spreading other illnesses from patient room to patient room were already in place, and so we just exercised those things to a greater degree because we didn't know much about the virus. And one thing that we're pretty confident in, and everybody has an opinion on so many of these things, but we see in our facility where people have appropriately worn masks, washed their hands, we don't have any problem with the virus being spread from infected patients to those care providers. And so we also have instances where people have been out in the public and they've not worn their mask for something or been to an event where they didn't know they were being exposed, and they got exposed and got the virus. So, those were just chance encounters, and these encounters where we have people taking care of patients every day, day in and day out, and staying safe, masks do work if they're worn appropriately and if other measures are taken. So that's just something I think it's important for people to understand. Whatever your opinion may be, we certainly have experience in that being very true.
Yeah, so unfortunately, even if you have the vaccine, we're going to continue wearing masks for a while.
I like to tell people it's a vaccine, not a cure.
Yeah, that's right. It is. So we're gonna still ask for your help in doing the right thing and wearing masks and doing good hand hygiene and staying home when you're sick.
So this is a question that just came in and sent to us. People are curious about the resources for contact tracing and new positives. How long is it taking to reach people that have been traced?
We're unique with public health because we are part of the hospital. So some of our cases we know about the next, the day of if they're rapid and as soon as they come in. So when we're looking at our lists of, school age kids, we are doing some of our contact tracing in that regards. But because we're busy with vaccine planning and the amount of cases that we're seeing, the state is doing some of our contact tracing. So that has been kind of a learning curve for us because we did feel like that we were, pretty on it. And I know that some of the numbers, what we've heard from people are not a local number. So that is one thing just to keep in mind if you are waiting for a call. And I know there's a lot of out of state, calls that people get, but it could be a contact tracer from, and they're from everywhere. The state has a couple agencies. So, answer those calls. If you're waiting for a call, we've said it'll be from us, not necessarily so anymore in November. We did have to turn over some of our cases. We do have nurses that are still contact tracing, but because the volume and planning that we wanted to do for the vaccine to have it go smoothly, that is something we did do. So
Yeah, but the day that they hit the system, they should get a call. So it should be same day.
And some folks out there were curious for a little more clarification on the educators, so teachers with vaccination. They were looking for other information for like the bus drivers or daycare providers or those. Where will they fit into this puzzle of first vaccination steps?
yeah, from what I've heard, it's not going to be just specific to teachers. It'll be education, like the different roles.
And
in there.
they did specify childcare providers
Yes.
as well in
Yeah.
1B. So we'll just need, like we said, we'll need that CDC recommendation to come down through IDAC at the state level and then match that up with the vaccine availability.
And we've also asked the schools and different entities to kind of tier their staff as to those that are, more high risk, and go through that route so we can, if depending on how much vaccine we get and how many are in those groups, that we can kind of tier that as well.
Just something I wanted to clarify real quick, and you can correct me if I'm wrong. Because I know when you said if it's in the system that day, you should get a call, and a lot of people are probably like, oh, but it took 3 days for me to get called. It's when they hit the system, so it has to pass through the lab first. So if it gets held up in the lab, it could be 3 to 4 days. So don't think you had the test and it should be that day. So I just wanted to clarify, because I have seen that a lot, and we manage the COVID hotline for the hospital and public health, so we do get a lot of those calls like, hey, this is day 4, why haven't I heard? Well, because the lab is still running that, or the lab's had some issues. I know they've run out of some agents every now and then. They're doing the best that they can. You got to remember, these labs are doing it the entire state. So I just wanted to clarify that, so no one's like, oh, it took more than a day for me to get it. So.
Yeah, thank you. Yeah, once the lab gets it in there, correct.
And then what is IDAC, guys? People might know.
Oh, IDAC,
The Infectious Disease Advisory Council at the Iowa Department of Public Health. So.
Very good. I think everybody's familiar with we've had COVID, or folks that have had COVID, you lost your smell, taste, the flu symptoms. But we're hearing about long-term impacts that COVID could be having. I mean, so maybe younger people aren't dying like our older folks are, but there might be some other long-term. I'm hearing heart issues. Or what kinds of long-term impacts are we seeing, and how that might play a factor for folks?
We don't know of any long-term impacts it may have. I mean, there may be rumors that I haven't heard of, but for certain, if you get a good healthy dose of the virus, people are staying sick for quite some time. I know of patients that have been sick for months, just wrung out. If you get it, it can make you very sick. And I think that's the question: is it real? It's certainly real. If you've ever seen somebody die from coronavirus, it's not fun to watch anybody die from anything when we wish we could help them. And so it's very real, and it seems to be more real for our elderly population for a variety of reasons. And for that reason, I think it's so important for all of us to be safe and to be careful, because we don't want to expose the vulnerable population to get something that may bother them a lot more than it would bother younger, healthier people. But also, younger, healthier people can get very sick with it. And so long-term effects, cardiac effects, neurologic effects, those things aren't really known and being experienced, but I'm sure there are rumors about those things. We think once you heal from the virus, you'll be okay, but some people, it just takes them a long time to get over it.
Well, I haven't gotten any questions here from the audience recently, but so I'd like to go, and hear a little bit more about your personal stories. I mean, how this has impacted you personally. I mean, I think we all see you as officials, and we know that it's part of your everyday life. I mean, we're talking about police and those folks, and they deal with most unpleasant parts of our life. But how have you guys been personally impacted by this virus, and how has it changed your life, and what do you think will change for you forever because of it?
Good question. That's a really good question, Ken.
Great question. I think from a hospital perspective, it's really made us stronger. Our team has really come together like never before. In the past, we'd never had virtual phone calls with all of our physicians and providers. And so we were doing that on Monday and Wednesday and Friday nights. And so as now we're into 2021, we're continuing those phone calls on Monday nights with 40 plus of our providers on Monday nights. And so the communication, the collaboration, it has really made us stronger. And so we're thankful for that. And that's a testament to our team. And so there's been a lot of positive changes that's made us closer to help serve the community. So.
He took what I was going to say.
I can also say, I think as providers, we've learned to listen better. I think early on, people are asking us our opinions. Nobody wants our opinions anymore. Everybody has one. And everybody's opinion is correct. And I think we can't convince anybody that basic medical knowledge, just like we use for cancer, just like we use for intestinal obstruction, like we use for appendicitis, like we use for anything, basic medical knowledge is something that we spend our lives acquiring, developing the skill sets for and the experience so that we can help people. And those things are being applied to this as well. We have no vested interest. We have no other reason to do what we're doing other than we want to help people. And so one of the best things we're learning in this is to listen and to provide help when people trust us to provide the help that we can, and not to get involved in lots of the discussions that are swirling around this, but just to listen to people and encourage them for the correct things that we know to do, that we're doing those. And I think it's made us better providers and a better hospital and a better team.
Well, I kind of have a follow-up for Mr. Robinson on this and seeing the everyday impact. We don't want to know specifics, specific people or what have you, but you get to, or you go go into homes or you help people that are suffering with COVID, and we don't see that. We don't see that. So when you see that and you help those people, and then you hear maybe misinformation or things that aren't necessarily true, or maybe they are true but they're skewed in one way or form or another, how does that make you feel? And what would you like to tell folks that, you know, this is what's really going on, and this is not good?
That's a deep question, Ken. I put my paramedic hat on here, but I mean, that is very frustrating. I've had lots of talks with lots of people about it, and like Dr. Breon says, until you see a patient dying of COVID, I mean, it may not be real to you. It may be just something you're reading on the news or you see on the internet. But I mean, we have seen these patients go, and they are sick. And you throw everything you can at them. Dr. North and Lisa have been fantastic. You know, they do a lot of the care centers. And I've been on those calls with Dr. North, and he's a fantastic physician. He's trying everything he can. It is hard, and you do want to have the right information. And right now, it's really hard to get the right information. But I would seek it out. You know, talk to your medical provider. Everybody should hopefully have a family physician. That's who you should be getting your information from. And not all the doctors are going to agree on everything. That never works. In my 20 years in healthcare, it's never worked. But you should be seeking that type of information, not looking what's on Twitter, not looking what's at Facebook, or even WebMD. You should be talking to an actual provider. And I'm sure there's plenty, if you don't have one, that would gladly have a conversation with you. But it is real. There's science out there that proves why things are being done the way that they're being done. And yes, science isn't always right, and it changes and evolves, and so do we. And you know, I've seen so many changes just in this last year because of COVID, with the science, with doctors, with other paramedics, and it's going to continue to evolve, and that's all we can do. And this is still new to us. There's a lot of things that are going to change, you know, long-term effects. What's that going to look like? We don't know. But as it starts showing, and as we start looking at the research and the things that need to be done, you know, we might have more PPE that we need to put out there, or different types of masks, or yeah. So do your homework.
Go ahead.
I was just going to say one more thing, and I think probably one of the most aggravating things that we see and hear about as providers is just the way that this is affecting groups of people outside of or in the community. You know, I've heard of and experienced families that are going through turmoil because of families being divided over their opinions about COVID. Business partners being divided based on their opinions about COVID. There are businesses that are going bankrupt not because they don't have business, but because they have such strong, hard feelings about the way they feel about this, they no longer want to get along. They no longer want to work together. This is dividing families, it's dividing churches, it's dividing, and it's really the way that people are looking at this, taking it home, swallowing it, and then expressing opinions that are dividing people. And that's probably the biggest damage that's coming from the coronavirus, is the fact that people are getting strongly held opinions. It may be pride, it may be some other issue, but they're using it as an excuse, and it's dividing families and groups of people that never should be at odds with each other just because of some opinion about some pandemic. And that's the saddest part, I think, and we need to be strong and be willing to encourage people to go beyond that. Have grace for people.
A question that's come in is, so the people are getting vaccinated. Is there some sort of documentation, you know, of their immunization? I'm trying to further read the question here. Will the vaccination be necessary if the person's been confirmed as COVID in the past, and should they be tested or confirmed for antibodies before they have COVID? You know, if they've had COVID, should there be some sort of testing that happens before they have the vaccine?
Get vaccinated. So, yeah, no, not at this time. If you've had the virus, definitely if you're in the midst of your isolation period, then, you know, wait till you're done with that. But there's no information that they want you to wait. So when you're eligible, it's a good time to get it.
As far as the documentation, we've been giving out vaccine cards. It'll show your date, and then you'll bring it back for your second dose. We also participate in the statewide system called IRIS, and so that will track your vaccine. So in some cases, you could get your first dose somewhere, get your second dose somewhere else, and that will document that.
Yeah, and starting Monday, they're going to be putting out maps and information on people in your county that have been vaccinated. So not everybody that lives in Mahaska County is going to get vaccinated in Mahaska County, nor are everybody in our healthcare that works at the hospital and that we give vaccine to necessarily. But they'll track those in your county that have been vaccinated and then how many vaccines you've given. So that's, information that will be probably released starting Monday. But Iowa has an immunization, the IRIS is the immunization registry system, and that's where most places put the vaccine, and that's where we're required to put it once we've given it so that they can track, what's going into people and what's available throughout the state.
And also, a lot of people are worried about, should you get the vaccine if you have immunosuppression, if you have other medical illnesses, if you have, and the easy answer is the more potential you have to get the virus and be really sick with it, the more important it is that you get the vaccine once it's available. If you're immunosuppressed, by all means get it. And also, don't be alarmed by the side effects. Everybody talks about the side effects. This is a vaccine. And this vaccine is gearing up your immune system. And when your immune system gets geared up, it makes you feel kind of goofy sometimes. And it can make you a little bit on the sick side because your body is preparing to defend against something that could potentially take your life. And so when that happens, you may have a fever. You may have some muscle aches. Those things are to be expected when you get a vaccine. It's not unique to this pandemic or to the coronavirus. That's just the way our body works, and that's how vaccines work. So many people aren't having any side effects whatsoever. I didn't, but other people are, and you may have more side effects from the vaccine if you've already had the illness because you already have some antibodies available. You may have a bigger immune response, not to be surprised by that. You may have more symptoms with the second vaccine than the first because you're going to have more antibody response to that second one. That's expected. Don't be alarmed by that. But it's something that we understand as medical professionals is very possible, and we need to be aware of that.
And also, we're starting what's called a Mahaska Health Medical Minute. And so we want to get the message out there. We want to get information out to the community. So be looking for that on our website and our Facebook page. And Patty Malloy is starting a podcast with that Mahaska Health Medical Minute, so be looking out for her.
Our current rate of people who've even reported side effects is well below 5%. I'm going to say it's 2 to 3% right now, and none have needed any medical attention. So I just want to put that out there.
And just because you've had the first dose doesn't mean that you're coronavirus immune. You really need to have that second dose then.
Yep. The full immunity is at some point after the second dose. So, yep, we definitely want to encourage people to follow through and get both.
All right. And we're getting a question about essential employees. Are you going to be working with employers for that, or are employees themselves going to be responsible for lining up a vaccination, those kinds of things?
So yeah, we've been in touch with some of the next group in the 1B and have those direct contacts. We're asking for their employees and the numbers to that because we will get a hold of them either directly or through their work. So again, when we get to that tier, I'm hoping that right now the employers are reaching out to their staff and letting them know that we spoke to them. So just check with your employer first, and if they haven't heard from us or they haven't contacted us, let us know at Public Health.
So another question coming in is, is this going to be a recommended vaccine for school?
Oh. Right now, that's not the age group, so it's, but down the road, it possibly could be.
It could be, yeah. Right now, it's not even recommended for kids. It just hasn't been tested in that age group. So, that would be several years down the road, I think.
A question coming in is about testing, and should people get tested whether or not they have symptoms? And will positive or negative test results impact any vaccination protocol or hierarchy?
So most people are being tested if they have symptoms. There are some cases where some people need to find out if they're going to travel or, certain issues. We are not a testing site at the hospital. We test symptomatic people, so we're involved in care. So if you're looking for testing, if you're asymptomatic, we send people usually through Test Iowa. What's the other piece of that? Oh, yeah, you'd want to seek care from your primary provider if you are ill. What's the other?
Well, yeah, Test Iowa and Hy-Vee, I would
and
say were
Hy-Vee,
the
yeah,
two places if you're, if somebody in your household, has been positive and they've been tested at a clinic, sometimes we'll say, presume that if they're having symptoms that they are. And then if you want to get tested to just have that confirmation, probably the Test Iowa and Hy-Vee sites and those are on the Mahaska County Public Health Facebook page, the links to those.
Well, we're starting to wind down, so you can all go. So we have about 10 minutes left, and I would like, if you can, just some final words of guidance, something that's important that maybe we didn't touch upon in all of these questions that you think would be important for people to know. And I suppose we can start over here with Mr. Robinson. Is there anything you'd like to add?
That's why you sit in the middle.
Do what Denise says. Again, make sure that you're seeking out truthful information. Hopefully from, this is a pandemic. It is a medical related illness. So to me, the experts in this is the medical providers. That's who you should be getting your information from. Speak to your family doctor. And let's all get through this together. I mean, that's the big thing. We just need to get through this so we can get back on track, get back to what we do every day and enjoy things again.
And I think just to reiterate the fact that Mahaska Health is there to provide health care for all things. So we're not just taking care of the pandemic, we're also still taking care of everything else we take care of. And we're doing it every day with a great team of dedicated people that are really stepping up to do things to help the community. And so once again, we're not motivated for anything other than just taking care of people. And so if you have any issues or concerns about the pandemic, make sure you connect with your primary care provider. You can contact anybody if you have specific information. Medical information is probably the best information right now through the hospital and through your provider. But if you have any concerns at all about anything, it's a safe place to come and get your care. So once again, we don't see the transmittal of the illness in the hospital as an issue, and we're taking care of all medical concerns in a safe manner, and your health is still our primary concern.
I would say this has nothing to do completely with COVID, but I pick words every year to help guide me through the year. Last year it was patience and persistence, and I had no idea how important those would be. This year I would say it's kindness and patience, and I would ask everyone to have that as we work through this. Everyone's lives have been affected by coronavirus, and everything has changed. So I think someone mentioned giving people grace. Being kind to each other, and having patience as we work through the phases with vaccination. We want this for everyone just as much as you do. So please help us stay focused and provide those vaccines to you just as quickly as we can. And please be kind to each other.
Yeah, I'd just like to take the opportunity to thank everybody in the community that we've, talked with, through some maybe COVID illnesses, and just the team that we have here at Mahaska Health and in Mahaska County. So thank you for your patience. And as we get the vaccine and the rollouts and the, who's going to be next, have patience with us. We just, we're doing, what we can to get it as we're allowed to do it. So just be patient, and Mahaska Health is a safe place to come. I think, there's a lot of people wanting it because we want life to be back to normal. It's going to take some time, so it's not going to be immediate. It is 2 doses to get fully vaccinated, and then we're still going to have to be cautious for some time. So remember that. It's not just going to be over in a month or 2 months, whatever. So just remember that. And if you're in that high-risk categories, keep yourself safe. Be careful who you're around, where you go, wear your mask, social distance. and avoid those high-risk activities that you could be around somebody that could potentially have COVID, because we don't always know if somebody has COVID, because they can be asymptomatic. So just keep that in mind, and we just want you to stay safe and healthy. And if you have any healthcare concerns, come to the hospital. It's safe. I feel very safe. And I've said that, people are like, "Are you afraid?" I'm like, well, I feel like where I work, we're extra safe and we're extra cautious, and we do all those things. So, like Dr. Breon said, we haven't seen, outbreaks in the facilities other than the patients that we're caring for. So, just keep that in mind.
I just want to thank the entire community for your support. We've had everywhere from food being dropped off to EMA and local builders helping us, to people walking around the hospital and praying over the hospital. And so we're just so thankful for that. And I just want to thank this team here and all our medical providers, nurses, caregivers. It's a special thing. And you should be proud of what's going on to care for this community. And we just thank you for tuning in today. So we appreciate it.
All righty. Well, I would certainly like to thank everybody for coming in here. It's a highly unusual year, and we're doing different things than we normally do. We really wish we were back at the confines of Smoky Row and smelling the coffee and enjoying each other's company. Maybe next year we'll be lucky enough we can get to do that again. So
Ken, we should have some coffee here, man.
we should. I actually bought some coffee, but I was too lazy this morning to make it. So. Yeah, that's. I'm just going to tell you the way it is. So I'd really like to thank the Mahaska Chamber of Development Group for helping make this stuff possible for us, and of course those of us here at Oskaloosa News and Thunder Country for the use of the studio, and of course Andy and Allison McGuire. They've been busy monitoring social media and piping questions into us through all of this. We'd like to thank our panelists for coming. It's a little squished up there, but they made the most of it. And so in 2 weeks, we'll be back in here, and we'll have Senator Ken Rosenboom, Representatives Dustin Hite, and Holly Brink, and we're going to be talking about issues that concern us at the state level. So until then, I look forward to a good response from our hospital and the vaccine, and you guys keep doing the things that you're doing to help our community. I'm Ken Alsop. I'm with Oskaloosa News, and we thank everybody for watching.